All right. So it's interesting. Some of the guys I see at the clinic, it's weird. It's like I consider them friends. It's like even though we only see each other at the clinic, it's like we have this. I don't know, this like connection. It's kind of interesting. Like some of them, some patients that I see, I just really consider a friend, and I feel like it's mutual. And it's interesting because sometimes guys will come to the office and ask to see me, and they'll be like, "Oh, Rich is my friend." And it's funny because the staff's like, "Is this your friend?" I'm like, let me see who it is. But it's interesting anyway. So yesterday I saw one of my patients who I consider a friend. Even though we see each other like rarely at the clinic. I don't know. I just like this guy, and I have respect for him, and I think it's mutual. So anyway, his name is Cassidy, and we were talking. Um, he, you know, anyway, the subject of smoking came up, and so I was talking about smoking, and then how just briefly how that affects the body. I'm like, it's not. I said people make it so complicated, and it's not. It's super super simple. It's like if you think with the viewpoint that a body is a carbon oxygen machine, right? It's this machine that survives off of oxygen. And the thing I always preface, nice bike by the way. The thing I always preface uh, with patients, what I kind of get the viewpoint to shift to, is if you were to lose all your blood, what will happen to you? And they're like, oh, I would die. So if someone cut your neck and sliced one of your blood vessels in your neck and you started to bleed out, what would happen to you? They're like, oh, I'd be dead. Exactly. Why? Because your body would would not be able to supply oxygen to all the cells, and our cells just need oxygen to live. That's just the bottom line. We need oxygen. That's how we are designed. So what happens when a person smokes? A lot of things happen when a person smokes. I'm not going to get into you know cancer and blah 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 and all that stuff. I'm just going to talk about straight up physiology and how does it affect the body, right? So it's interesting. Smoker, when they're young, they don't feel anything. You know, I noticed that my smokers in their 20s, they feel like they're invincible, and it doesn't really affect them as much. They don't really have a cough. It doesn't really cause any issues. They do fine. In their 30s, the same thing. They don't feel anything. In their 40s, not a whole lot. Maybe towards the mid to late 40s, they start to notice that their energy level, their ability to move their body starts to be affected. And then by the time they're in their 50s, they definitely are feeling things. They're feeling chest pains. They're feeling shortness of breath. Even though they sometimes don't acknowledge it, they definitely feel this. I don't care what anybody says. By this point, there's definitely some effects, some physiological effects that the body now has because of cigarette smoke. Now, what does it do? Um, Smoking, if you think with, just think with the fact that the lungs, like what's the purpose of the lungs? The job of the lungs is to get oxygen from the environment into the body. That's essentially all we really want. You breathe in air, it gets into the lungs, and then from the lungs, it's able to go across the cells or the air sacs in the lungs into the blood vessels, and then oxygen gets across the air sacs, alveoli, and then it diffuses into red cells, and in the red cells, it goes into the molecule called hemoglobin. Hemoglobin is what actually carries oxygen, and that's the transport of oxygen for our bodies, right? So that's the basic gist of it. So when a person is smoking, what happens is obviously, you know, analogy I like to use is if you take acid and pour it on the back of your hand multiple times throughout the day, what happens to your skin on your hand? It gets chewed up, right? It gets destroyed. Now, why? Because that skin, that type of tissue, is not designed to handle acid. So that's a problem. Now, guess what? Your stomach, the lining of your stomach, produces acid all the time. Why doesn't it get chewed up and destroyed and just made dysfunctional because it's designed to handle that, right? It's definitely designed to handle that type of environment. So acid in the stomach is not a big deal. Um, the same thing is true for your lungs. Your lungs are designed to handle oxygen, um, air, oxygen. That's it. Nothing else. It's designed to handle gases that help the body survive. Exchange gases. Um, when you smoke, you're dumping in a whole bunch of chemicals into your lungs, and that definitely creates scarring in the lungs. And so it makes it where the cells cannot get that oxygen through from the air sacs into the blood vessels. It's just, the lung tissue becomes scarred, so it becomes harder to transport oxygen from the lungs to the red cells and the hemoglobin. So it's interesting. What does the body do to compensate? Most of your smokers, their body starts to compensate. You can see this when you check their labs. You can see this when you check their vitals. For instance, smokers actually have thicker blood. Why? The body compensates for the lack of oxygen by making more red cells and more hemoglobin. So a smoker, whenever I see a smoker and I check their labs, I'll notice that their hemoglobin numbers are higher than a person who is a non-smoker. So like an average person have a hemoglobin, let's just say about 14 or so, 13, 14, and then a smoker will always have a hemoglobin about 2 points higher. So they'll be like 15, sometimes 16. And so your smokers, their blood tends to be thicker. When you have thicker blood, guess what? What's easier to suck through a straw, water or a milkshake? Exactly. So smokers are making it a little bit harder in that their blood is thicker than a non-smoker's blood. That's the first thing. The second thing is the chemicals in cigarette smoke definitely damage the lining of blood vessels. I remember when I was at Meharry in med school, one of our professors, I don't know if he's still there or not, this guy Cecil Cohn, I remember it stuck with me. He said that you can always tell a person when you do an autopsy. You can tell if they're a smoker or a non-smoker or an alcoholic. And he said it was interesting. He said an alcoholic has very clean blood vessels. They don't have a lot of plaques and scarring in their blood vessels. Of course, their liver is jacked, shriveled up, looks like a shriveled up sponge, and their heart is stretched out. So don't think that alcohol is good for you. It's not. And then he said a smoker always has chewed up pipes. He says when you do a cut down on the artery in a smoker and you look at the artery of a smoker, he says it always looks like a rusty pipe. It's just chewed up, plaques, calcium. It's just completely chewed up like what you'd expect. He says as you do the autopsy, or you can tell, oh, this guy's a smoker before you even get to the lungs. You just look at the blood vessels. You can tell that they're a smoker. So again, my smokers, as they're spending their time doing their thing, one, their blood is starting to become thicker and thicker because the body needs to compensate. You need to get oxygen to the cells. You're not diffusing as much oxygen through the lungs. So what does the body do? Quick, make more red cells so we can transport more oxygen. Great. That's the first thing. Now the blood is thicker. The second thing, okay, guess what? Your pipes, they're now no longer nice, clean, smooth pipes. They're now calcified, chewed up, rusty on the inside, smaller diameter pipes. So it makes it harder for blood to flow through your smaller your smaller pipes. So that's the second thing. So yeah, those are two things that smoking definitely creates. And so, what does a person perceive? Well, guess what? If your blood's thick and your pipes are kind of scarred down and narrow because of the smoking, you can't get blood to where it needs to get to. So then your smokers start to feel it. They definitely have a hard time exercising, and I noticed that as they age, they start to get issues with pain, especially in the lower extremities, like the legs. They'll get they can't walk very far when they start to walk because the body physically cannot get blood and oxygen to the lower extremities. They hurt. So smokers, once they hit their late 40s, they don't like to exercise because their legs hurt, physically hurt, because they can't get oxygen to the legs to move them, to run and do certain things. They might not acknowledge it, but that's what happens. And then same thing, with their heart. Their heart, obviously, with the scarring of the blood vessels and the thickening of the blood, and the heart, when you try and exercise, and the heart, the demand on the heart goes up, where you need to like really start pumping out some blood to the body, and the cardiac output, the demand goes up. A person's been smoking for a while and starts to get these physiological changes to the body. They just can't do it. They start to feel, number one, their body just physically can't do it, and then if it's bad enough, sometimes they'll start to get their chest pain. That's when I see my guys in their 40s start to quit. You ask them, "Why'd you quit?" "I just felt like quitting." It's like, sure, that's what it was. Yeah, they start to feel the problems of the smoking, right? They start to feel, you know, they're starting to get it. They're starting to get the limitations just from smoking for a while. The good news is, bodies are dynamic. Things change. You can definitely improve the condition that the body is in. Definitely, I think, in my opinion, probably the worst thing a person can do for their body is smoke. I know some people disagree, but I see it all the time. And from a physiological standpoint, it absolutely makes no sense to put chemicals in the body that literally limit the ability to function and do what the body is supposed to do, which is move. And we do that by getting oxygen to all the cells. And when you smoke, you definitely create a problem in the body doing that. Anyway, that's what I was thinking about since yesterday, and talking to Cassidy. And sorry, Cassidy, I put you out there. Hopefully you don't mind. Too bad. They don't know your last name. So yeah, that's all I got. We'll talk next time.